Hi, everybody. I'm live. Everybody's expecting this. So while we're waiting for people to get on, if you listened to the podcast this morning, here is my Mother's Day gift from my sweet little Sadie girl. Okay, and we're both so disappointed. This was our goldenrod yellow, but you know what? I love it. And she knows what's going on. She's been following. So I told her I'm doing a live. And I told her I was going to drink my water out of the mug. And she said, make sure you show it to them. She hasn't heard today's podcast. She listens to the podcast to fall asleep to. So while we're waiting, we'll go listen to the podcast. Really important episode, probably the most important episode that we've put out so far in all 82 episodes. So please go give that a listen. It's streaming everywhere. If it's not streaming everywhere, let us know and we will do the work to get it in the spots we're missing. Okay, I think people are joining, so I'll just jump in. We have a lot of new followers. We're approaching, or I think we actually just crossed 55,000 across Facebook and Instagram. We have a TikTok now, so I very quickly did a live about 20 minutes ago introducing myself over there because we're brand new to a lot of people over on TikTok, and I invited them here for this. So if you're new, I'm Jeanette. I am the founder and the owner of Fix SLP. I was in academia for over 10 years and left last February. I own a mobile fees practice and Fix SLP. Currently, we have a team of 5 that run Fix SLP, and we all do it for free. We're hoping to start getting paid, so that's why you see some affiliate codes out. But that's who we are. That's what we're doing. And one of the reasons why we started this platform was for this moment. And that reason was funneling advocacy efforts for the field through social media. The main advocacy effort that we've focused on to this point is gaining our autonomy back, because we feel like ASHA has taken that autonomy away from us. That looks like making the CCC optional in every state, as it should be, since it is a proprietary product. Again, listen to this morning's podcast episode where we talk about how we are alleging that ASHA is really probably breaking the law through their proprietary product. So here we are. We are in this place. I'm going to give a little history lesson. We are in this place because the CCC was put into place to protect consumers before state licensing boards existed. I am intimately familiar with what that looks like because I was educated in a state, Michigan, that did not have a licensing board when I graduated. So my professors, used to try to get us to advocate at the state house to make that CCC or to get that state licensing board. So I know what that looks like. Before there were state licensing boards, you had to get the CCC to show consumers that they were hiring a trained professional. Once state licensing boards were in place, the CCC was no longer needed. But because of the years of advocacy and lobbying that ASHA did to make it required, it stuck around. One of the things they also did, and this is why we are sitting here right now having this conversation together, is that they offered their help to every state establishing a license. They knew they weren't going to win that fight. ASHA knew there was no way that there could be a profession, especially one that touched the medical field, without licensing boards. They couldn't fight that. They knew they were going to lose. So they helped. And what their help looked like was getting these states to align their license with the requirements of the CAA and the CCC. And so all of these states, except for North Dakota, I've been mad at North Dakota for 21 months, okay? North Dakota, thank you for what you do. Except for North Dakota, all of these states created a temporary or provisional license, or some states don't have anything at all still during that period. They have something in that 9, or in Virginia, 6 months that SLPs get while they are doing their supervised experience. And what we all say is, why do we have this, right? It's abusive. And this isn't across the board. There are certainly good mentors out there. But there are enough of these stories where it's abusive, it's problematic. We never see our mentor. Why do we have this in the first place? And so what CMS has done, CMS is a federal program. It's the Center for Medicare and Medicaid. It's a federal program. What they've done is they've called ASHA's bluff. That's what they've done. So ASHA's saying we're not competent until we earn the CCC. No, what we're earning is our state license. We're also earning the right to purchase the CCC. But competence is literally in the name, Certificate of Clinical Competence. So we've earned the right to have this CCC by gaining our competence through that supervised practice. So CMS has finally said, fine, earn the right. Go for it, everybody. Go earn it. But we're not going to pay you because you don't have a full license. And that's why we're here. Because all of these states, 49 states, plus Washington, D.C., created a temporary provisional license while we got that supervised experience. It's not called the CF in every state. Professional supervised practice, mentorship period. Every state has different names for it. Some states require that you go through the actual CF and not have to purchase the CCC. But every state has something different. But at the end of the day, other than Virginia, which is 6 months, we all have to do this 9-month supervised experience. And CMS is saying, go for it, but we're not going to pay you until you're done. And can't say I don't disagree with them, because we are competent at the end. If you listen to the podcast this morning that we recorded 2 weeks ago, I said on the podcast, the only thing we gain at the end of the CCC, especially if our mentor has given us the minimum requirement of 1 interaction every 3 months, the only thing we've gained is a year of work, which we could have done without this process, a year of work, and a certificate that says I was supervised by someone who's part of the multi-level marketing scheme. That is why we are here. ASHA has created this mess. And in order to get us out of this mess, they are going to have to admit that the CCC is not relevant, or that the CF is not relevant. That's what they're going to have to admit. They're going to have to tell CMS, you're right. It's not relevant. What they'll have to say is, SLPs are competent enough to do this job and be paid for it because they've done the requirements. They've earned their degree. They're full professionals, just like PT and OT. Well, then the question stands, well, then why do they have to be supervised? So what ASHA is going to have to do is single-handedly dismantle their CF process in order to turn this thing around. And they're not going to do that because the CCC is what pays for ASHA to exist, even though it's a membership association. And if some of this is new to you, we've been around for 21 months. We have over 500 pieces of content on our Instagram alone. Go find something, go listen to something. So very quickly, yes, somebody asked the CF, it is for the Virginia license. For the Virginia license, to our knowledge, at least what we have on our mega spreadsheet that was crowdsourced, it's 6 months for their license. But if you're getting the CCC, you have to do the 9. So we could be wrong. We only catch mistakes when people correct us and send us the correct regulation. But we do have links for every regulation that's on our website. So, all right. So what are we going to do about this? Because we don't just educate. We don't just scream and yell on a podcast. We don't just put out inflammatory remarks on the internet. We're here to actually make change. And I feel like for the last 21 months, we've been training for this moment. We have overturned Medicaid regulations in 3 states. We learned a lot of lessons. We have a House bill that is being introduced on the House floor in 2 weeks, 15 days, that 2 of us, Alexa and I, are being called to testify in favor of, which is a really full circle moment for me. And that bill will make it illegal to require the CCC for billing in the state of Michigan. We have worked with Congress people. We have worked with aides. We have learned lessons about how to work with these folks at the state level. We have been to state board meetings. We have worked with licensing boards. We have worked with all of you. We have built the infrastructure to communicate with all of you and allow all of you to communicate with each other in a very safe space. We have a back-end system that we use for our state teams. We are in a position to mobilize all of you. So what does this look like? We'd like to take a 3-prong approach. Number 1, we need to talk to CMS. So that's going to be the first thing. We see that ASHA has a petition. They should know better than anyone. Go look at my stories. They should know better than anyone that petitions don't do anything. Okay? Petitions don't do anything. Sign it if you want to. That's not going to get it done. And they know it. By the way, the invitation is out there. I'm putting it out there now. If ASHA would like to join us in this effort of saving this profession, we should all probably partner up. So if they want to collaborate with us and work together, the invitation is there. Have your lawyers call our lawyers, because right now we can't talk to each other. But the invitation's there. They're watching this. Okay? So we want to talk to CMS. ASHA is asking CMS to just reinstate what was already there. What we're going to ask CMS for is a 2-year extension, because some state legislators only go into session every 2 years. And a lot of this change, all of this change is going to happen at the state level. Most legislators are in session right now, and they're getting ready to wrap up for summer. Okay? So we're going to talk to CMS. We're going to ask for a 2-year extension. And what that will do is it will, 1, save all of your jobs if you're losing your jobs, because we're hearing from people that they are. And 2, it will stop the workforce crisis and the access to care crisis that we're about to experience, because we need our new grads to take the jobs that they're in and that they've accepted and haven't started yet. People are going to lose care because of what just happened. And that is the focus. It is not a woe is me, I lost my job. Yes, between us, we can talk about that on our platform. You can message us. This is a serious thing. It is, okay? But that's not the message that we send to CMS. That is not the message that we tell them. The message is there's now a workforce crisis and an access to care crisis for the people that we serve and the people that you provide insurance care to. That's the message, okay? So together, we will get a template. We are working on the very best people to send this letter to. It's not going to be a petition. It's going to be physical letters, maybe not even emails. We're going to flood them, okay? There are 200,000 CCC holders in this country. Let's send them 200,000 letters, minus the board, the 15 or however many on the board that they're doing their own thing. Flood them, okay? So that's prong number 1. Prong number 2, we're going to start talking to our state boards, okay? State boards, prong number 2. It is very likely that most of these state boards do not have the ability to make the changes we're going to ask for, but beginning to talk to them for a partnership or a change in putting a red line bill, a red line change out there is in everyone's best interest. Okay, because if they're not on board in some states, change will never happen. And remember, there are people all over this country on state boards who work for ASHA, who volunteer for ASHA, who love ASHA. They're signing ASHA's petition right now while the rest of you watch this live, okay? So as much collaboration as possible is important. It's very important. CMS, state boards. If state boards can make changes, great. This gets done really fast. Third prong, we're going to talk to legislators and we're going to try to change laws and get rid of these provisional temporary licenses. So here's what we're going to ask for. CMS, we need more time. We need 2 years. 2 years to make this happen because some states only meet for every 2 years to change laws, okay? CMS, give us time. State boards, state legislators, get rid of the temporary provisional license. Get rid of it. Okay? We don't have those things anymore. You graduate, you apply for your license. If we need an example, we can look at how North Dakota does it. Again, love you guys. Good job. I'm sorry for what I said. Okay? So if we need that, we can look at North Dakota's example, and we will. Full license out of school. Now, I think a lot of us can agree, and I think this is where we're going to be split in the nation. And I want to make sure that this is not divisive. This is a unified effort through Fix SLP. We are in this together, whether we agree or not, because our goal at the end is the same, and that is to save these jobs and to save these students and to save our profession, okay? We're unified, even if we don't agree on this next point. I personally feel, and you don't have to agree with me, we can still be friends. Supervision and mentorship is still needed when we hit the field. People don't know what they're doing. They're not being adequately prepared in academia. I lived there, okay? People need us. They need seasoned SLPs to help them who care. We have heard horror story after horror story after horror story. This is our opportunity to rewrite this profession and rewrite this mentorship crisis. So here's what we're going to do. We're going to go to these state boards and we're going to, in your state teams, you're going to collectively discuss all of this, come up with the best options, maybe you modify it. But typically, in your first year of practice or in your first license cycle in your state, you don't do continuing education. You don't do professional development. So we create a mentorship program for the first cycle or even just the first year. We don't have we're not dug into any of this, but this is what we're looking at doing. Okay? It operates like you're reporting your CEUs. We don't need extra tech for this. It is a simple reporting process with the mentor registered with the state, just like it is in most states now, okay? We already know there's a crisis where we're not getting enough supervision. This is our chance to ask for more supervision. So maybe in the first year, you have 9 face-to-face interactions with your mentor. Maybe there's some guidelines. We get to rewrite this. We know what the problems are. We're the experts, all of us, everybody here, everybody watching this tonight, everybody watching this in a week. We know what the problems are. Let's write it into our state regulations. In lieu of PDH or CEUs the first year or the first 2 years, you get your mentorship experience. But we're not going to call it that. We're not going to call it mentorship. We're not going to call it supervision. And this is where y'all get to name it, okay? We don't have a name yet. We need to name it something different. Okay? So maybe Elizabeth's on there. Elizabeth, get up a post, okay? Elizabeth needs to do some work. We're going to have a post that says, name the new supervision period. Give us some suggestions. It has to be strong. It has to be good. Nothing cute. Remember, these are state boards. These are legislators. Something serious that communicates what this is, but doesn't call it what CMS doesn't like, okay? Nothing that indicates we need extra help. This is for continued growth in education. So we can build that into the first year or the first 2 years, whatever states want to do. They don't even have to do it. If Pennsylvania decides, give them the full license and then they're done, cool. States get to decide, okay? So build that in. So that option 1 is just give us the license and then we're done. Option 2 is build in this mentorship experience that will allow people to still get the help that they need without having a provisional license. We go to the legislators with that. We talk about the access to care issue. We go to our state boards. We talk about that. And we see this change through. We've been working on our state bill in Pennsylvania, in Michigan for over a year and a half, almost since Fix SLP started. So we'll call it 20 months, and it's finally being introduced on the floor. It took that long. This is not an overnight fix. So unfortunately, the CFs in this position, our best bet is to immediately start approaching CMS and asking for an extension. We will get those materials out very soon. If you are not on our email list, please go to fixslp.com, scroll to the bottom and subscribe. I think we have sent a total, if you want to count the 2-ish state emails we sent to specific states, I think we've sent 14 emails in 21 months. We only email you when there is something to say. We are going to be using that. We'll be leaning into that communication because you guys open those emails. Our open rate and our click rate exceeds the industry standard in every single size industry there is. Our email list is big. You guys open those things, you read them, and you click the links. And from the bottom of our hearts, thank you for paying attention and engaging, okay? Go subscribe. We won't spam you, I promise. So that's one way. We are having a new website built. There's no worse time than this. So we're having a new website built. Our website cannot hold a lot of stuff. So we will likely have a drive set up so you can access information. The other thing that we need to do is build state teams in places we don't already have them. So we need you all for these things. We have a huge list of states with people who have volunteered to help but can't lead. We need leaders. We need so many leaders. If you are willing to lead this effort in your state, go email right now, states@fixslp.com. Go email. Say, I'm in Pennsylvania and we already have great leaders in Pennsylvania. I can't think of a state off the top of my head, but I will lead. Leading does not mean doing the work. Leading means you're organizing the effort and you're communicating with us because we can't have 50 people on state teams sending us emails. The state team leader collaborates with us. You disperse and everybody assigns and the work gets done. And then if someone's not doing the work they said they'd do because something comes up, then you make sure somebody else is doing it. Okay, so you're more of an organizer, not the worker bee. Well, you're still working, but you're not doing it alone. Okay, so we need team leaders in every state. If we don't have a team leader, we cannot make these changes in your states. We can't. We need leaders. If you don't want to lead, that's okay. We are all created differently for all different purposes. If you don't want to lead in your state, but you do want to help with this effort, email states@fixslp.com. I live in Maine. I want to help. Someone will get back to you. Please expect that we are about to get hundreds of emails. This is going to take time, but we are ready to start accepting that. In the meantime, we on our end, we will get together the CMS information and we will get it out to everybody. And then as these teams form, we will start getting you in our back office system so you all can collaborate. So I hope this all makes sense. I have my team. I think it doesn't look like they've put any questions. Are state board members getting money from ASHA? No, state board members do not get money from ASHA. State associations sometimes get money from ASHA. they can apply for grants, which is why many of them are apprehensive to interact with us. So state associations, if you're out there, if you want to collaborate, we've got relationships with a good handful of state associations. Let's collaborate. This does not need to be divisive. This is not us versus you. This needs to be unified. And the more unified bodies we can get here, the more successful we're going to be. I need a drink. Did I spill? Yes, I did. Okay. Welcome to my life. All right. So if you have any questions, you can start asking those. My team's going to put them in a text message that I'm watching because it's hard for me to watch your comments. But that is our plan. Residency was a name option. Please listen to our podcast from today. I don't think residency is a good idea. I think it's too close to fellow. It's too mixed in. Good start though. We'll hit the nail on the head. We'll find something good. So Elizabeth, I know she's already making that post. So we'll have that up soon. I'm going to repost this. The next thing, the other thing, we have two more things actually. Please share the heck out of this account, out of this live, out of the information that you like on our accounts on every platform, Instagram, Facebook, and TikTok. Please go 5-star rating and review our podcast. That is how we find people not on social media. We need to reach the people not on social media. It's really important. Out of 200,000 people, we have 50, well, if you add TikTok, we have 56 or 57,000 people following us. We still have 150,000 friends to meet. So liking and bumping up our podcast is really important because it will be suggested to others. So please do that. The other thing is, some of this is going to take money. We have an administrative assistant who sometimes helps us 2 hours a week or so with emails. She is going to help us sort through these emails. We pay her a fair, competitive market rate. And so if you have the finances, please consider becoming a sustaining partner. Again, this is a long project. We all work. We all do this for free, but having this little bit of help is really going to go a long way for those of us on this end who need to organize all of you. And that's how we're going to pay her. So if you have the $5, or you want to send a one-time donation, we can take PayPal, or we have a PO box. We can get you that information. So please consider becoming a sustaining partner. We're going to need that money. Also, we're still pushing through. I got a letter from our lawyer today, and I am probably gearing up to meet with ASHA. Okay? So we're still paying lawyers for the lawsuit following the petition that they wouldn't address. Okay, let me look, see if there's questions here. Board, okay, residency. You want a timeline for talking to CMS. Don't start until we get you the information, and then we will probably put some deadline on it. We don't need to keep this rolling, but the sooner we can get to them, the better. I saw ASHA's deadline was June 25th. Whatever. We'll figure it out. So we will have instructions. If you've never seen any of our call to actions, we usually have a folder on a Google Drive. Down the road, when our website comes out, everything will be on our website. But for now, we use Google Drives. Everything will be in there. So there'll be a template, there'll be instructions, there'll be addresses or exact places where things need to be sent. And it will be all very clear. You won't be able to modify our documents, but you can copy them and then send them out. All of the state stuff will be in our back office system, specifically for the teams that are created. They won't be made publicly available. Clarify the role of the state teams. The state teams are the ones who are going to have to do the work. You're going to have to talk to the board. You're going to have to talk to your state legislators. You're going to have to do the work in your state. We are not stakeholders. We can help represent you as an advocacy firm, and we are very effective in that. Look at what we're doing in Michigan. We can help represent you. We can go to meetings with you. If you can't go to meetings because you have to work, we'll make sure one of us is at a meeting. when Delaware was looking at changing their state policies, I drove in one day 6.5 hours to Delaware, sat in a 45-minute meeting, and drove 6.5 hours back. So we will do whatever we can to support these state teams. If we see something is working in one state, we will make sure all of the other states know. Okay? Something's not working, that didn't go so well, we'll warn you of that before you do it too, so you're not wasting your time. So that is what the state teams are going to do. You're going to do the work in your states because we can't do it. We'll do the work on our end. We'll fund the stuff. We will get you organized. We will give you the software. We will get you the addresses, but you guys are the ones who have to talk to your states. Okay. What should CFs do now? Great question. This is really important because I'm seeing, especially on Reddit, I am seeing a lot of really bad advice. Some of it was even given on our TikTok account. Number one, seasoned SLPs, if you're listening, we are not in a position to be telling CFs what they should or shouldn't do. This is unprecedented. We don't know what's going to happen right now. We don't know. We can't tell them, stay the course or go find a new job. And we shouldn't. Okay, that we should not be doing that. Remember, your company is looking out for only your company and they don't care about you. So if they say, we're going to stay the course, just keep showing up to work and billing, you could do that. My concerns as I was laying awake last night thinking all of this is ignorance to the law is not a defense. And we're not ignorant anymore either. So can the money since April be recalled? Absolutely. If you billed since April, that money could get recalled. You wouldn't be responsible for paying that money back. Your company would be. Some of these companies, if they recall money, are going to have to repay back millions of dollars, which would bankrupt companies. So is it likely to happen? No. Could it? Absolutely. All of these people saying, well, CMS doesn't have a way to find out if it's a CF or a new grad or a fully licensed SLP. It doesn't matter. They have ways. People have gone to jail. CMS has sent people to jail. They are a federal program. Okay. So, you know the rules now. Is billing fraud? Probably. So this is what we are suggesting. Fix SLP is suggesting you find a lawyer and you just have a half-hour conversation or a 1-hour conversation with what is going to protect you. Can I go back to work and bill? Should I, don't trust your job. Definitely don't listen to your CF supervisor if they're telling you to stay or go. This is also a huge problem because we realize you all just graduated. Nobody has any money. None of you have started jobs. Not everybody has parents and families with means. So if you are consulting with lawyers, share that information with one another because there are a lot of you that aren't going to be able to do that. So that is our advice. We can't tell you what to do, and your CF supervisor shouldn't be telling you what to do. You need to talk to a lawyer to make sure that you're protected and to make sure that you, moving forward, wouldn't be held liable or found liable for Medicare fraud. That's what I'd be concerned about. That's the biggest thing. So if you can, talk to a lawyer. But you have to do what you feel is right. And this is a scary time. And it's okay to ask questions. And it's okay to share information with one another. We don't have the answers because this has never happened before. Okay. Okay. Are we seeing any questions? Any more questions? I'll give everybody a minute to jump in. But again, share the heck out of this account. Once we start sharing resources, share resources. Okay? No. I'm not seeing anything else. So you can always get with us. team@fixslp.com is the place to email with questions. You can hit DMs. This, we go in these waves where things like this happen, and we do get a lot of messages and emails, and we get really backed up. So Please be patient with us. Since the beginning for 21 months, we have answered every single text, or well, you guys aren't texting us. We have answered every single DM. We have responded to every single comment. And if we don't, it's just because we simply miss it. But we try our best to connect with all of you. So please be patient. Remember, we're working. I'm leaving for vacation in a couple of days. We will respond to you if you have, oh, okay. Now all the questions are coming in. Hold on. Okay. Can you review your guidance and goals with the states? You can watch the replay. We're going to replay that. Do you think this changes because of ignorance or malice? My biggest question is, this change is not new. All of this happened in 2015 for home health. It has not been enforced. My question is, where has ASHA been for 10 years on this? Whether it was being enforced or not, they should have been advocating. And for all of the reasons I said at the top about how they will have to dismantle their own program to turn this thing around is my opinion as to why they weren't doing anything. There was a law on the books. They should have been doing something. And if they would have, where we're at right now could have been fully avoided. So ASHA is a business. If you're new here, this is new information. Spend some time with our content, but ASHA is here for ASHA. ASHA has shown over and over and over again that they only act when it benefits them and when it benefits their bottom line. So it wasn't in their best interest to do something about the 2015 changes because it would have impacted their CF program, and then they were going to lose money. That's what I know. How will this affect school SLPs? Well, there are a small number of Medicare recipients that are under the age of 65. So I looked at the list today. If kids have ALS, if they are at end of life, there are a couple very specific reasons why kids get Medicare. If a child that you serve has Medicare, you will not be able to bill Part B. Or if you're seeing them in a hospital and they're Part A, you need to have a supervisor in the building who is available in order to bill Part A. So that's one way how it's going to affect our school and pediatric SLPs. The second way is it will likely flood the job market because people are going to need jobs. Now you have double the people applying for these jobs. And here's what I'm going to say to this. Don't settle. Because employers, schools, not all private practices, we have some really great private practice owners in this field, but like pediatric practices owned by corporate companies are going to take advantage of this. And they're going to offer you a lower rate because they know there's 5 people in line to take the job and one of them is bound to say yes to the lower rate. Don't settle on a lower rate because of what's going on. The last thing we need to happen now is to devalue our field even more. Don't let it happen. New grads, this is your call to action. Do not settle for a lower rate because there is a line of 15 people behind you. Stand strong, okay? All right, so y'all are going to be competing for more jobs. Can CFs treat Medicare A patients without supervision on site? No, they cannot. I'm not seeing any more questions in my text. All right, guys. Watch the replay if you didn't jump in from the beginning. I know this is kind of long, but this is a serious problem. Spread the word. Get people to our accounts. We're here. We're working with you and beside you. Hang in there. I hope in less than 2 years this has all come to an end. We have said for 21 months we are here for the long haul. I quit my job. My job in academia is gone, okay? Because of Fix SLP. So we're not going anywhere. We're here. We're here. We will help you see this through. All right, guys, hang in there. Get in our DMs or our email if you have questions. Bye, everybody.